Good morning, ABC Medical Center team. We have purchased a new electronic health record system. I'm excited to present the many functions and abilities that our system has to offer. As the CEO of the company and a healthcare provider, I have been looking for a system that benefits both the clients, the providers, the administrative side, and the business. We are trying to provide exceptional care, and these technologies will allow us the platform to be productive and have workflow in the environment. The new technologies and advances in healthcare have created huge varieties for us to access information and stay connected with other providers and our clients. Some of the functions that our electronic health system will provide are patient records. The system will store and help us to create patient records. All of the providers in the facility will have that are treating that client will have access to that information. So that keeps it standardized. It lets everybody on the same page. There's going to be fewer mistakes, and we will all have access to the information we need, so we will not have to spend time looking up that information or searching for it from another provider. And if a patient has received services outside of our facility, we will have access to that information as well. Another thing is the client's history and medications will be stored in this system. That means we will be able to see what medication they are on, their histories. They try really hard to provide us with their own history, but nothing gets lost in translation, and they don't have to sit there and explain that to us anymore since we have that access. All of our clinical documentation, progress reports, notes, daily documentation can be done on the system. That means we are able to actually track how much we have completed, what needs to be done. It creates a standard template for all of us. So that way all of our notes and documentation look the same, and then other providers have access to that information. And it helps us to track when we need to do a progress note or when an evaluation or reassessment needs to be completed. An automatic system will actually notify us of that, so we do not have to manually go through that. So that helps both the provider and administration. We can create care plan guidelines and protocols. So things like home health programs or uniform protocols that we use here at the facility, they can all be put into the system, and then we all have that standardized format, which is really beneficial to us, and it keeps the uniformity, which we are looking for. Specific instructions about a client, like post or pre-op information, can be accessed through the system. So there should be nothing getting lost. There should be less mistakes. Everybody will have access to the information we need. Discharge instructions, anything that we need to prep, any specific treatment instructions will be popped up on the system. Same with orders. We can just directly put in an order for medication or a test, diagnostic test or care orders can just automatically be processed through the system by the provider, and then it goes directly to where it needs to be. Administration work can be done through the electronic health records system. So administration can actually do scheduling and access the patient's demographics. And we do have features where the patient is able to access and make changes to their schedule. So that helps us all be more consistent, and it'll prevent things like missed visits or a client not getting the visits that they need or missing appointments. So scheduling, we all will have access to that information, and we as the providers can see too when a patient is scheduled, and we can actually plan for our day better too. Standardized tests and protocols are all on the system. So once we input that information to the system, it just creates a standardized template. So that allows us to be able to put that information in. And I know we've all spent a lot of time trying to manually do standardized tests. So it's really nice to have a system that helps calculate that for us and keep everything really uniform. The other great benefit of the system is that it maintains the security for us. So electronic health records that we have chosen are HIPAA compliant. So it keeps everything secure. We all have unique logins, and it helps us maintain HIPAA compliance, and it helps us be able to communicate with other providers and our patients while maintaining that compliance. A lot of the advantages of the electronic health record system are that it allows for communication between physicians. So we can diagnose quicker, we can make assessments quicker. care is more efficient and accurate, and that gives us more time to treat and more face time with the client when we have the access to the information we need. We don't have to backtrack at all, and we can use our clinical reasoning and make decisions faster. Access to the patient's information is quick. It's right there. It's all been put in. If the patient has said it or been there or experienced something before, it's already in that system. So nobody has to repeat anything. And once again, this creates more face time with the client and more time focusing on the actual treatment. It's secure. So our systems are secure and protected. We can communicate with the clients. We can communicate with other physicians through the secure platform that maintains compliance with HIPAA, and no violations of privacy can occur unless we're sending out information deliberately, but the system itself protects that. Our hope is that this will increase our productivity. The efficiency that the electronic health records provides should help kind of the workplace flow better. It'll make our clients feel more satisfied. It'll make us feel more organized and uniform as providers. And we get to spend more time using our clinical reasoning and providing treatment to our clients. The quality that electronic health records help create helps more thoroughness and accuracy. It allows us to use our clinical judgment because we have more access to resources. There are actual resources on the system, and that can help us increase our clinical reasoning and make better judgments because we have those quick tools available to us, and we don't have to go to the library and look it up. We actually have those information and resources available to us immediately through the system. Since we have access to that information and we have a more organized system and a uniform system, and those tools are provided for us, I am expecting more engagement with the clients. And I know that's something as providers we really struggle with, is we feel like there's a lot of things in our way before we can even treat the patient. So we will have quick information and resources available to us. We will be able to spend more face time with our clients. Our clinical decisions will be more confident because we have the proper access to information. Our abilities to diagnose, assess, and make a plan will be more efficient and organized. And our clients will then end up trusting us more, and our treatment will feel more sincere. They will not have to repeat histories or information. We can provide them with a means of communication through the EHR system that feels more personable to them. We'll have to spend less time having to fish for information, and this will just create a more engaged and personal treatment experience for both the client and us as the provider. The system provides a platform actually for us to communicate with our clients. Both administration and the provider are able to do scheduling. We are able to answer questions, instructions, can be given through the system. And the efficiency that the system creates allows us to be able to communicate with the client and stay connected. And that way we're not going to miss appointments. We're going to be able to maintain services and maintain care, provide home programs, ask questions, and that way when the client feels more connected, they're more compliant with their treatment program, and that makes it better for both us and the client. The use of social media and technologies greatly increases our accessibility to clients. The use of new systems and technologies allows us to stay connected and access information. Both clients and professionals can input information into certain social medias, and we can retrieve the information using technology. A really great benefit to us is mobile health technology, which gives the patient more control of their own information. Mobile technology is another secure form, and it's HIPAA compliant, and it's a system that allows the patient to use their own device, such as a tablet, their computer, or their phone, and communicate with us, whether that be scheduling or asking questions about their care or what's expected. And once again, that creates more compliance with program and keeping with appointments. We can actually use social media technologies to publish and share information through video sharing. So this can be instructional information. We can try to prevent disease. We can be active in participating in public broadcasting, which provides the client with information. And we can demonstrate healthcare maintenance strategies and give that access through video sharing. Blogging and social networking allows the consumer to review their opinion of their services and recommend our facility to others. So that's one way that the patient will be using technologies to input information into electronic systems. And the patient will have access to their version of the medical record, so they can input information, they can change information if they need, they can access instructions on their care or protocols on their care. So once again, we're seeing more compliance. The overall goal of our electronic health technologies is to improve productivity, workplace flow, and efficiency. We are attempting to optimize our abilities to provide exceptional care and tools and platforms to stay connected and keep information accessible. All right, guys, thank you. I'm excited to be able to utilize this system and create a great workplace flow and optimize care for all.